In this session, we will be discussing about pneumonia. As an introduction, it is the infection of the lung parenchyma due to which there is deposition of inflammatory exudates in the alveoli, which results in consolidation or solidification of the lungs. Now, moving on to etiology. The etiology of pneumonia can be broadly classified into two sections. That is, the first one is mainly due to the lowered systemic resistance of the host, and the second one is the impaired local defense mechanisms. So, talking about the lowered systemic resistance of the host, this can be mainly due to immunodeficiency. The immunodeficiency includes the defects in innate immunity, humoral immunity, or some defects in cell mediated immunity, or this can be due to the use of some immunosuppressive agents, maybe due to leukopenia, because in case of leukopenia the WBCs are numbers are low, so as a result our immunity will be less. The second etiological factor is impaired local defense mechanism. We know the main local defense mechanism in lungs includes the mucociliary apparatus as well as cough reflex. If both of these are lost, this can lead to accumulation of secretions, which can lead to cystic fibrosis and bronchial obstruction, which further leads to pulmonary congestion and edema. Now let's discuss about the classification of pneumonia. The classification of pneumonia is mainly done based on three major criteria. The first one is based on the anatomical distribution, the second one is based on the etiological classification, and the third one is based on the clinical setting in which the infection occurs. Based on the anatomical distribution, it is of three types: lobar pneumonia, bronchopneumonia, and interstitial pneumonia. We will be discussing in detail about lobar pneumonia only. Now, talking about the lobar pneumonia, as the name suggests, it is clear that the lobes are affected. Maybe some parts of the lobes may be affected, or the entire lobe may be affected. It mostly affects the lower lobes. So it is the diffuse inflammation affecting the part or entire lobe, usually the lower lobes. We are told that it is a diffuse inflammation. So this inflammation is mainly morphologically classified into four stages. You can memorize it as CRGR. This CRGR stands for mainly for the four stages, that is congestion, red hepatization, gray hepatization, and resolution. Talking about the first stage, that is congestion, it lasts for less than 24 hours. That is, the congestion stage is just less than 1 day. So talking about the gross appearance of the lung during this congestion stage, the involved lobe of the lung is heavy, boggy, and it appears red. Thus it will its appearance will be red, boggy, and heavy. On cut section, it will show a blood stained frothy fluid which oozes from the cut surface. Talking about the microscopy, the alveoli are filled with pale eosinophilic fluid. So we are told that it is inflammation, so inflammatory cells will be there for sure, right? And there will be congestion of capillaries as well. So in microscopy, you have to memorize two important points. The congestion of capillaries will be clearly seen, and the alveoli will be filled with pale eosinophilic inflammatory cells. Moving on to the second stage, that is red hepatization. So from the name you must be wondering why red hepatization. I'll explain it to you now. So this stage only lasts for 2 to 3 days. The first stage, that is congestion, lasts for 1 day, and the second stage lasts for 2 to 3 days, that is red hepatization. So as in gross appearance, it appears to be red, firm, and airless. And this firm consistency of the affected lobe resembles that of the liver. That is why it is called red hepatization, since it is red in color and its firm appearance is similar to that of lungs. And in cut surface, it shows a red and granular appearance. Talking about the microscopy, alveoli shows exudates with fibrin threads, and within the fibrin threads we can see red blood cells as well as neutrophils. So that is about red hepatization. The third stage is gray hepatization. It lasts for 5 to 7 days. Talking about the growth, it slowly loses its red color and assumes a gray color and it is firm. Thus the name gray hepatization. So that's about growth. On cut surface it shows gray and granular appearance. Then talking about the microscopy, we have already told that there was fibrin and exudates, that is fibrinosuppurative exudates in the red hepatization, in which there was neutrophils and red RBCs. These neutrophils then gets replaced by macrophages and the red cells undergoes disintegration and this fibrin contracts. As a result, there's a clear space between the alveolar wall and the exudate. This is all about microscopy. Talking about the fourth and final stage, that is resolution. Resolution occurs by liquefaction. That is, the fibrinous exudates that is present within the alveolar spaces undergoes progressive liquefaction to produce granular and semi-fluid debris. Talking about the growth, the affected lobe becomes more crepitant and on cut section it appears frothy. On microscopy, the alveolar spaces shows granular materials and semi-fluid debris. Talking about the clinical features of pneumonia, sudden onset of fever, chills and cough with mucopurulent sputum is the most important clinical symptoms of pneumonia. Now we have to discuss about the complications of pneumonia. The first and most important complication is the formation of leg abscess. It is mainly due to the extensive tissue destruction and necrosis. The second one is the spread of this infection to the pleural cavity, which can lead to pleuritis, that is inflammation of pleura. It can also lead to pleural effusion, that is fluid in pleural space, and it can also lead to pyothorax. Pyothorax, that is a pus in the pleural space. Then it can also lead to bacterial dissemination, that is bacteremia, which can cause endocarditis, pericarditis, and meningitis. It also leads to organization and carnification. Organization is the ingrowth of the granulation tissue into the alveolar exudate, and carnification is the increased alveolar fibrosis which leads to shrunken and firming of the lobes. That's all about pneumonia. Thank you.